I think drugs are a really important issue in Asia because, firstly, because governments have made it a very important issue. A lot of countries have made it a high-profile state security issue. So drugs are often framed as a threat to the security of the nation and to families and communities. And because of that, a lot of countries have developed very punitive drug policies. So they have really extensive impacts on especially people who use drugs, but also on their communities. Like, for example, if you are arrested for drug use, you might be sent to prison, you might be ordered to go through corporal punishment. So in countries like Singapore, Malaysia, Brunei, you could be caned. You could also be sent to what are called rehabilitation centres to force you to stop using drugs, and you could be detained for up to 3 years in a country like China. And in these rehabilitation centres, reports of torture, a range of other abuses, forced labour is heard of. So it's important because governments have made it such a huge issue, and then it's had such a huge damaging impact on people in the community. And often the impact is felt worse by people who are already marginalised, because people who use drugs, people who, for whatever reason, end up engaging in dealing or selling drugs, the ones that are most easily arrested, the ones that are most visible to police, are often the ones that are the poorest. And they're doing it because they have little other option to sustain a livelihood. If they go into prison, often they might have people dependent on them, their parents, their grandparents, and their children. And so if a person goes into prison, those people could be left abandoned without care. And this is a problem that we're hearing more about in a country like Thailand. Sometimes both parents, the mother and the father, end up in prison for a low-level drug offence, and their children are left abandoned. So often you hear of the slogan for the regional drug strategy for Southeast Asia. So the regional body is called the Association of Southeast Asian Nations, ASEAN is the acronym. So their drug strategy aims to achieve a drug-free region by 2015. That's this year. It's just a few weeks left. And needless to say, they're nowhere near achieving that goal. They have that as their overarching vision, and underneath that they have a number of objectives that they've set, and it's always about trying to significantly reduce or eliminate the size of the drug market, so the volume of drug supply and the numbers of people who use drugs. And with all the available data that we have from the United Nations Office on Drugs and Crime, don't show a decrease at all, least of all a significant decrease. So we can see from the objectives that governments have set for themselves that they have failed to achieve the drug policies that they have decided upon. But it's also a spectacular failure in so many other ways because of the unintended consequences or the negative consequences of the drug policies that they have set. By deciding on policies that focus only on trying to reduce the size of the drug market, they've ended up damaging and committing a lot of human rights abuses. In the name of drug control, governments are willing to impose really harsh punishments to make people stop wanting to do anything relating to drugs. And that is obviously not working. And if governments say that we're just trying to protect our communities from this evil of drugs, well, they've made it worse than if they hadn't done anything at all. If you put someone into prison just for using drugs, if you lock them up in a so-called rehabilitation centre where they're exposed to a range of abuses, and then after they come out, they have a diminished chance at rebuilding their life again. If they have a criminal record, it becomes harder for them to find a good job, harder to get to school. They become more stigmatized and isolated from their family and their communities because they're seen as a criminal or as a bad person. So the policies that governments have decided upon have made things worse for someone, and arguably worse than whatever drug that person was using might have done to their life. The alternatives that we advocate strongly for governments is to take a health-based approach to drug use. That this should be seen as a health condition that needs to be approached or responded with health-oriented measures. So we recommend, for example, decriminalising the use of drugs. So if someone is using drugs, if someone is in possession or carrying drugs that is for the purpose of their own personal use, then they should not be given a criminal penalty, or actually any penalty. That people should not be punished if their only activity is using drugs. And that they should be offered options, good options for health, harm reduction services that could help them maintain a good quality of life and health, even if they choose to keep using drugs. And we advocate this not because we support or condone drug use, but it's simply admitting or facing the fact that there will always be people who choose to use drugs, whether you like it or not, whether you really don't want them to.